Hi everyone, I'm here to introduce the Food Law and Policy Clinic. So the Food Law and Policy Clinic works with communities, partner organizations, and government actors to improve the laws and policies that govern our food system. We're working with projects centered around food loss and waste, food access and nutrition, the Farm Bill, food system workers, and community-based food justice. Our projects on food loss and waste focus on crafting policies in the US and abroad to get food to those in need or otherwise divert food from the landfill. Some law students are working on policies that build nutrition education into the medical school curriculum and promote nutritious and medically tailored diets to reduce health issues caused by diet quality, which is now the leading cause of death in the United States. Law students working on the Farm Bill advocate for food justice in a spectrum of areas, from supporting minority farmers to promoting environmental conservation. Other students work to protect farm workers and give this vulnerable community more legal support in the face of workplace struggles such as pesticide risk. In East Cleveland, we're working with a local organization called Loiter to achieve food justice through policies that promote a sustainable local economy. In all our projects, we strive toward a more just and equitable food system. Thank you.
Welcome, everybody. I want to thank, first of all, the Harvard Food Law and Policy Clinic for hosting us here. Can everyone hear me okay? Okay, great. Thank you for co-hosting this event with us in this beautiful space. I want to thank our panel moderator, Michelle Sicolo, who I'll introduce to all of you in a moment. Our panelists, thank you all so much for your time, your energy, and your expertise. And I want to thank all of you who are here with us today. I want to thank the FoodLink staff for pulling off this event in 4 weeks. The board, volunteers, donors, partners, and many of you from Harvard and beyond. There are too many of you to thank individually, but I want to recognize that all of us here are collaborators in the food security space. So the premise of today's forum is that the issues of food security and food waste are so broad, the best way to tackle them is by bringing together our public servants in dialogue with innovators from the private, legal, and nonprofit sectors, as well as those who have direct lived experience of food insecurity. Only through the intersection of all these voices can we move the needle in a meaningful way. I'd like to share a bit about FoodLink before introducing our moderator. We are a food rescue organization, and what that means is we collect surplus foods from supermarkets, farms, and retailers who are moving the products off their shelves, and we redistribute that food to community organizations serving those who need it. Our mission and vision are up on the slide behind me. We've invited each of our speakers to share what food justice means to them so that we can build a clearer understanding of what an equitable food system looks like and how to achieve it together. What we hear in our work at FoodLink from the folks we work with daily is that what matters most to them are choice, dignity, and access, so their needs can be represented in our food system. And now, it's my pleasure to introduce State Representative Michelle Sicolo, our panel moderator for today. Representative Sicolo is our state representative for the 15th Middlesex District, which includes Lexington, Woburn, and Winchester. First elected in 2018, Representative Sicolo is the co-founder of the Bipartisan Zero Waste Caucus, and she's also an active member of the Food System Caucus. Thank you, Representative Sicolo.
Good morning, everyone. Can you hear me? I'm on a portable microphone. Okay. I think it's fine. If people can hear in the back, or I can, okay, I'm getting a thumbs up. Terrific to be here with all of you this morning. This is such an important topic, and I want to thank Rachel and FoodLink and all of the organizers, especially the student organizers who helped make this presentation possible. Food policy is really crucial to the work that we're doing. I started off with my interest in food probably because of my upbringing. My parents both grew up in poverty, not far from here, one in Cambridge and one in Brighton. They were one of 6 kids each, so there was always a lot of them, and food was always scarce. But they instilled in me an appreciation for how incredibly important food is for our health, for our vibrancy in our lives. And certain principles, that food should never be wasted, that food is sacred, and that it should always be shared. And I think that's something we really forget about here in our society, because we have so much hunger and lack of access to food, and we're not really appreciating how much opportunity we have if we share what we have to make sure that food goes around and nobody goes hungry. So in the legislature, when I worked for 20 years in community development, and one of the projects I worked on was a project with the federal CDC where we won a grant to do food access and healthy living projects with a number of communities, including some low and moderate income communities like Framingham. And that really instilled some of my interest in trying to make sure that we have good food policy. So when I was elected to the legislature, I promptly joined the Food Policy Food Systems Caucus, and then later founded the Zero Waste Caucus, which a component of that focuses on waste. So 40% of our food is wasted in the United States, which is a shocking number. And DEP, the Massachusetts Department of Environmental Protection, estimates that 20% of the waste stream is food or organic waste here in Massachusetts. The 21%. And food waste produces methane, which is a very dangerous greenhouse gas. And some say that, according to estimates, that if food waste were its own country, it would be the third largest producer of greenhouse gas. So we really, for those of us who are also environmentalists and not only concerned with the poverty and access implications, we also have to be very concerned about the environmental implications. And because of the pandemic, food access has gotten even more scarce. And between 2020 and 2021, 30% of Massachusetts residents experienced food insecurity. They did not have enough to eat. There was not enough access to nutritious quality food. And a recent study from the Urban Institute found that national rates of food insecurity have increased from 20 to 24% in 2022 due to inflation and the pandemic era benefits ending, which is something that we're looking at in the legislature. How can we bolster our supports in Massachusetts now that the federal government is withdrawing some of the supports from the pandemic? Black and Hispanic communities face much higher rates of food insecurity than white communities. So this is also a very critical food justice issue. And food rescue plays an important part in the emergency food system. It helps to ensure that good food that would otherwise be wasted makes it to food pantries and homeless shelters and other places that provide food assistance. Eastern Massachusetts is blessed. We have quite a lot of organizations working in this sphere. You've heard a little bit from Food Link, and we're going to hear more from them. But Massachusetts is home to a lot of food rescue. Well over 1 million pounds are rescued each month here in Eastern Mass, which is enormous if you stop to think about 1 million pounds of food. But we can do better, and we need to do more. Organizations like Food Link and Loving Spoonfuls, Food for Free, Boston Area Gleaners, one of my favorites. They go out into fields and make sure that the produce is not left on the vine. Rescuing leftover cuisine from restaurants and other commercial kitchens. Food Rescue USA and others, they work daily to recover and redistribute this food to those in need. The Greater Boston Food Bank plays a pivotal role. They organize all the food pantries across Massachusetts and make sure that the distribution is equitable and well organized. So we're going to hear a little bit about some of our federal bills from our colleague. And there have been some amazing things happening in this space. The Bill Emerson Good Samaritan Act for the Food Donation Improvement Act, and enhanced tax deduction for food donations, which helps to make sure that there's an incentive to actually collect that food and donate it instead of throwing it away. And in the state level, we have increased our ban on food material disposal. So now a half a ton, if you produce a half a ton or more of organics waste, you have to compost it. You can't throw it away, and it can't be burned. So there's quite a lot of legislation happening, and I'm going to wrap up. As part of the Food Policy Caucus, there's 27 different pieces of legislation we're supporting, and some of them are incredibly exciting. I hope we'll hear about them a little bit later. And now I think we're going to turn it over to the next panelist and begin our program. We have a fantastic group of people who will be speaking with us today. We're going to start with Emily Broad-Leib. And I think instead of reading out long bios, we put them on the screens. That gives our speakers even more time to speak and share with us. So Emily, take it away.
Thank you. All right, can you all hear me? Okay. All right, well, let me first take a moment to welcome you all again. So as you can see from my bio there, I'm a clinical professor of law here at Harvard Law School. We're co-hosting the event. And in addition to the thank you that you heard already, I want to give a special thank you to Tori Odo from the Food Law and Policy Clinic, who did the heavy lifting for today, as well as our students. You already heard from Noelle, and you'll hear from Sophie later. And just to say a word about what we do here at the Food Law and Policy Clinic, our mission is really to support businesses, nonprofit organizations, startups, growers, individuals, communities, government officials, in really better understanding the laws that regulate the food system and finding ways to change those laws and reform them and make them even stronger. And the way that we do that is by including students in every aspect of the work. So we have students in the clinic that are learning about how to do this work by engaging with the clients that we have in the clinic. And as you heard from Noelle, we work across a huge range of projects. There's so much really, if you talk about, thinking about food justice, which is really a driving force behind the clinic. We're trying to make the food system healthier, more equitable, more sustainable. And I think the way that we really think about that is that justice means that everyone should share in the burdens of the food system. There are burdens. There are environmental burdens. There are costs involved. And those should be borne equally no matter where you're from or, no matter race, ethnicity. So getting rid of those disparities. And the benefits should also be shared too. That means having more food security, having access for everyone, and using the resource that is our food in a more thoughtful way. So I'm going to mainly talk about a couple of things that we're working on related to food waste and food recovery. But I know from some of the questions people submitted that hopefully we'll get into talk more about food security programs and food as medicine, which is another big focus for our center. So in terms of, you heard a little bit about food waste, and one of the reasons that we focus so much in the clinic on food loss and waste is that there's both so much opportunity to make the system better, but also because it's really a triple bottom line opportunity. So I think you heard a little bit from Rep. Sicolo about the environmental impact of food waste. We invest a lot of energy and into producing food, and then when we throw that food away, it's a big emitter of methane. But also, when you think of triple bottom line, it's people, planet, and profit. The people side of it, when we think about the number of people who are food insecure, and obviously not all of that food is safe and delicious and edible. So it's not that all of that food can make it into the hands of people who need it, but the large majority of it is, and that's really been something that we've learned about in the clinic, is how much food is being wasted for really silly reasons, because there's confusion over what can be donated, there's a lack of clarity in the laws, and really a lack of incentives. And then lastly, in terms of profit, here in Massachusetts, which has been a leader nationally in terms of a policy in the state that restricts the amount of food that can be thrown into the landfill, within 2 years of enacting that policy, Massachusetts saw the creation of 500 new jobs and $175 million in new revenue just by treating food as a resource and not throwing it away. So I want to share like 2 or 3 quick things we're working on right now in this space, but I want to first give a shout out to my good friend Doug, who you'll hear from soon. We're sort of backwards in order, I think, but because in keeping with the way that we do things in the clinic, all of our projects really start from work with individuals. So the clinic had been around, we were a couple years old, and I got to meet with Doug and talking about the issues that he had seen as the president of Trader Joe's, with even a really conscious company like that, recognizing a lot of food being wasted and thinking about how to change that. I don't want to steal his punchline about what he does, but we got into talking a lot about some of the legal issues and questions with things like confusion over the date labels on food, which primarily are an indicator of quality, but most people think are an indicator of safety, and therefore they throw that food away. And we talked about some of the barriers in innovative food recovery organizations like his, with the liability protection and tax benefits that we heard about being a little bit outdated and old-fashioned in the way that they think about, who's rescuing food and where it's going, and making it difficult to really innovate in this space, which is what we need if we're going to reduce the amount of food going to waste. So that was more than 10 years ago. We both kind of continued on the path, have stayed in touch and continued to collaborate. And now our program is we've worked with partners now in more than 24 states. Right now, for example, we're helping prepare legal fact sheets for state government in a couple states on really helping them understand date labels, the tax benefits and liability protections. We're in the process right now working with a broader coalition of partners, which are the Natural Resources Defense Council, World Wildlife Fund, and a group called ReFed that does a lot of research on the best opportunities to reduce food waste. We're about to publish a state toolkit that really goes into detail on 15 different state-level policies that can be implemented to reduce the amount of food that's being wasted and be really thoughtful. I mean, the top thing we can do is prevent that waste, but the next best thing is to really get it to people if it is safe and edible and delicious. So that's underway. And then the last thing is we've been doing a lot of work preparing for the next U.S. Farm Bill. So for those that don't know, the Farm Bill is a piece of legislation enacted by Congress about every 5 years. And the last Farm Bill, was over $400 million authorized over 5 years. So it's huge legislation, not only for agriculture and farming, but really for all of food. It includes the SNAP program, which is the most important program for getting dollars in the hands of people who are food insecure. So we've been putting out a bunch of recommendations across the Farm Bill, but particular to the food waste and food recovery space, there's a couple things we're really looking at in that we think could be really well suited to the Farm Bill. And one of those is really to help support states that want to enact policies like this Massachusetts policy that's restricting food going to landfill. From working with partners in Massachusetts and other states that have done this, we've seen that they are incredibly transformative by saying, you can't throw food away. It's not waste. It is a resource. It should be donated, and if it can't be donated, it should be turned into food for animals or turned into compost or energy through anaerobic digestion. But this takes a lot of resources, so one of the key things that we're looking at is how can we get more resources in the hands of state and local government that are trying to experiment with implementing these policies and need resources, especially for food recovery organizations like FoodLink, like Daily Table, that are going to have to really do the hard work of continuing to grow and scale up, making sure that food gets to people. So I could probably talk for 25 hours if you let me, but I'm going to turn it over so that we also have time for questions and discussion. So thanks again for our partners in helping put this together and for all of you for being here.
Emily, thank you. And thank you for your amazing work founding the center and all of your focus in policy and law. And I think it's really great when you work with students as well, because you're inspiring the next generation of leaders in this sphere. So it's such important work. Our next speaker is Joe Brown. He's an artist and FoodLink recipient, and we're very much looking forward to hearing your perspective as a recipient of FoodLink services.
Thank you. For breakfast today, I had 2 eggs, toast, and real coffee, not instant. You're thinking, who cares? I never met this man before. If it wasn't for FoodLink, though, probably wouldn't have had anything, not even the toast. FoodLink's assisted me and my wife in so many ways, and I'm going to try to tell you a short story about it, try to make this as pithy as possible. In one sentence, I'm an artist. Now I know you might be stereotyped, thinking that stereotype, he's a starving artist. Maybe a bohemian, someone from La Boheme, maybe Vincent van Gogh. The antithesis is true. My wife and I have several homes with my mural business, you'll see it. We had a fleet of vehicles, we had a crew of 10, I was making over $100,000 a month. My wife worked with me until she got very sick. I started doing murals as a teen, and I did my friends' houses when I was in school. I did it for free. I built up a portfolio, I started going to interior designers. I met with over 110 of them I worked with. Only one of them's in business now. By the 1980s, they had catapulted me in homes that were 7,000 square feet. That was a big home in 1980. 1990s, I was in homes that were 30,000 square feet. In 2000, we started doing 50,000 and above. That's Home Depot's 100,000, gives you an idea. I was working from Park Avenue to Miami. Central Park South, I did Mary Higgins Clark's condo, 54th and 5th, the Lehman Mansion with Mr. Zimmer, Zimmer and Associates. Fisher Island, I work for Oprah Winfrey and many other people on Fisher Island. Palm Beach, the Swanson family, the Pantone family, that's the Pantone color. Sarasota, the Imes family, that's the Imes dog food. Orlando, the Van Campbell Mutual Fund Company. I did athletes like Alonzo Mourning, center for the Miami Heat. I worked for the Dolphins. I worked for the New York Giants and many other sports figures. I worked for Bob Marley's entire family except for Bob. I worked for Vanilla Ice, whose real name is Rob Van Winkle. I was on TV with him many years. But in 2008, we had a crash, and it affected me. The stock market went down, and so did excess money from even the rich. By 2015, my work was at a dribble. I was getting about maybe one job a year. My wife and I lost our homes. We lost our business, our fleet, my crew, and our account, my bank account. I did become the proverbial starving artist. I was like Marcello in La Boheme. I would have been Vincent van Gogh, but I had no brother to beg money from. But out of the blue, it came in 2016, a wonderful call from a man named Robert McDonald. Never heard of him before. He was the U.S. Secretary of Veterans Affairs in the Obama cabinet, CEO of Procter & Gamble. He said, come on down, we want you to do our entire house. So they flew me down, we did the whole house, and with about one deposit, I called Jana, my wife, and I said, go out and buy a trailer. And that's what she did. And that's why we have a trailer today, that's where we are. Well, after we finished that, by the way, Rob McDonald's a wonderful man, his wife and I keep in contact still. Most of these people are really, really very wonderful people. After that, we decided that I better get a 9-to-5. So, with some problems with that. First of all, I'd only done murals my whole life, since I was a teen. I never had any other skill set. Secondly, I had 0 degree. I failed art in Malden High School. I failed art at Boston University. Yeah, yeah, I did. I could show you the grades. And so, my wife found this ad on the internet for a bus driver in Belmont. I didn't even know anything about Belmont. We went over there, and I got the job. It's been the most wonderful job I could ever have. Much easier than doing murals, okay? I'm going to live a lot longer now. And murals are just nothing but stress. And the thing is that I got to meet the ladies of Food Link there, and it turned out to be a wonderful, wonderful time. And I asked them, I said, could Jana and I just have a little food here? And they were so benevolent. They helped me so much. And then I asked later, could I help others? And you're going to see some pictures of some people here that I give food to regularly. The first lady is Mrs. Kroom. Her husband was an F-16 fighter in the Air Force. He has 2 degrees. He was a major engineer on the Big Dig project. He passed away. And Mrs. Kroom has a lot of trouble making ends meet. You'll see there with flowers from Food Link. Then we have Joe. That's my neighbor next door. Joe he wasn't born blind, but he had a terrible accident. And he needs assistance, and I drop by food almost every other day. Nanan, a wonderful man from Staples. He works at Staples and at Stop & Shop. He has 2 jobs. He has a family. This man has several PhDs. It's unbelievable. And he cannot find a job in his field. And so this is what he's doing. The next one is Casey and Steve. And Casey and Steve are wonderful people. They all work several jobs. They can't make ends meet. Then we have Ed. Ed's my neighbor, wonderful man. I give him some food occasionally. We got Mike. Mike Milano. You'll see a house in the background with Mike. He's losing his house. He's in foreclosure. Some days he can't make it. He's a mason. He's 72 years old, and he's still working as a mason. Then we got we got Brandon. Brandon has been unemployed since COVID. He cannot find a job in his field. He lives in his trailer, moved in with his mom, and his grandmom's 92 right there beside him. And then we have Frank and Mary, and they're wonderful. Frank is very proud of his truck. It's 500,000 miles on that. Frank says he can't live without coffee, so I try to bring him that once a week, and they're just wonderful people. None of these people want to be in the situation they're in. Time and unforeseen occurrences befall us all. It's hard enough to see a hungry dog, never mind a hungry person. It's a human right for all of us to have enough to eat. And it should be all of our responsibility for that. America is the #1 food exporter in the world, the #1 corn producer in the world, the #3 in wheat, #5 in potatoes. No one should be hungry in this country. Revelation brings out, they will hunger no more, nor thirst anymore. Until that comes true, we have Food Link. So we're happy to say that. In conclusion, I'm going home tonight. My wife is making some food with Food Links food. She's going to make me chicken, salad, green beans, and I hope nobody will say, who cares?
Joe, thank you for that inspirational speech. It really helps us all put names and faces to the reality of what people are facing. And it's really important to center this work around the human side of things and not just the policy side, although we all love the policy. The policy is there to help us make sure that nobody goes hungry in Massachusetts and in this country. It really is shameful. It's something that we should not tolerate. It's something that shouldn't exist. We have the ability to eradicate hunger if we just have the will to put all of our resources together. So I'm so appreciative for your words and for your sharing. Next we have Doug Brow, who's the founder and president of Daily Table. Doug, we're looking forward to hearing your words.
I'm tempted to cede my 10 minutes back to Joe. Note to self, never follow Joe. That was quite profound and inspirational to me. And so I thought I'd pivot on what I was going to say a little bit and say that I grew up also on the side of end of the month was tough. My dad was a student. He figured out a little later in life that he didn't want to have various jobs, insurance salesman, et cetera, and went back and got his bachelor's and his master's and eventually his doctorate at Ohio State. Until I was about 12, I was just, you know, a kid of a family where my mom stayed home to take care of the kids. And the second and third and fourth weeks of the month got tighter and tighter. And I grew up to remember that, even when he went on to become a professor and things got better. I then went into the food business, not something I expected to do, but ended up with this opportunity with this little company in Los Angeles that had 9 little stores, some funny name called Trader Joe's, and ended up developing their private label food program for Joe Colomb, and then writing the plan on how years later we're going to grow this business outside of California. And so I did the business plan and said, we're going to Boston. Everybody looked at me like, are you out of your mind? Is there anything further away from Los Angeles? And so that's where we should go. So it brought Trader Joe's here in '96, worked 12 years spreading it around the country, and then graduated from Trader Joe's after my 31 years there. Had the opportunity to do a fellowship at Harvard, where I had the chance to meet Emily and the wonderful work that she's doing. And when I started this fellowship, which was called the Advanced Leadership Initiative, and it was taking people at their senior stage of life that still wanted to get engaged in the world, particularly around social challenges and social issues, and do something about it, which is the part that attracted me. That I was driving in from Newton to the campus here, and I'd see this billboard. And this was 2009 and 2010, the Great Recession, and it said 1 in 6 are hungry. And I drove by it once or twice, and I went, wait a minute, that's 50 million plus people. Like, how can that be possible? We're the richest nation in the history of the world in food production. And probably my generation probably is the first people on the planet that my entire life I've never worried, do we have enough food to feed ourselves as a country? So my parents had gone through the Dust Bowl and the Depression, and they really had taught me that food is precious, and it's a precious resource, and waste not, want not, et cetera, et cetera. So I thought about that and said, well, there's something I don't understand here. I mean, we've got all this food, and yet we got 1 in 6 are hungry. So I started a process of learning, and very quickly developed into an understanding through getting to research this, that hunger isn't what I thought it was. Hunger isn't in America, for most of those 50 plus million Americans, a shortage of calories. It's a shortage of nutrients. And it's not so much getting a full stomach as much as a healthy meal. Now there are, and we certainly have heard examples, and there are many people, far too many, to whom just getting something to eat is still difficult. But the 1 in 6 or the 1 in 8 that are food insecure in America, the vast majority of those are unfortunately pushed down through economic reasons into food choices that are causing all sorts of major health issues. Obesity is the face of hunger in America. And diabetes, heart disease, hypertension, et cetera, estimates are that 70% of these issues are all health related. That if we could simply provide the nutrition needed 70% of these issues would disappear. And we look at what the healthcare tsunami is on America, of what happens by feeding and not allowing access to affordable nutrition, is profound. So my second big learning was not just what hunger was, but then I had a conversation with the CEO of Feeding America, Vicky Esquera at the time, in 2009, 2010. And the big aha for me was when I asked her, what's your number one problem? And she said, oh, it's real simple. At this moment, now it's 2010, 38% of the population that qualifies for SNAP and our services at food banks don't use them. And I started my type A personality of, solving the problem for her, which was it because there aren't enough locations, or you don't have the marketing money, or there's a language barrier, or maybe they're afraid of ice, or, And she said, whoa, slow down there. Not so fast. It's so simple. They're ashamed. They're embarrassed. They don't want a handout. And of course, it goes right back to Maslow's hierarchy of needs, that it's so profound for us, that idea of human dignity, that people truly are hungrier to keep their dignity than even their health. And so I think that the issue for me was then, how can we create a dignified response that would include all these 38 to 40%, which, by the way, front page of the Boston Globe, May 5th, 2021, had a study from Greater Boston Food Bank that showed, and just revalidated those numbers almost exactly, of the number of people that in the midst of a pandemic were very aware of support services, but didn't want to use them because they wanted their own sense of self-reliance and agency. So I started down a path, and it ended up with Daily Table. What Daily Table is a 501c3 nonprofit hunger and food equity relief masquerading as your corner food store. I would say probably 7 out of 10 of our customers have no idea we're a nonprofit. All they know is that we're a spot they can go, get good food. We don't carry anything that won't move you forward in your health. So we don't carry soda and cake and candy and cookies. We're drowning in sugar in America. There's a floodplain. There are food deserts, but we're in a floodplain of sugar. And so instead, we provide, and we were the first retailer working with the City of Boston to provide Double Up Food Bucks, a wonderful program that I hope is going to get a lot more support federally, that allows a person on SNAP to get fresh fruits and vegetables and frozen fruits and vegetables at half price. And we introduced this program, I think, about 4.5 years ago. Phenomenal success, not just a success from the standpoint of removing the economic barriers, but through studies that are done by Sarah John at Tufts Friedman School, they've been able to demonstrate that from looking at our data, from the over 250,000 transactions, when we introduced Double Up Food Bucks, people on SNAP shopped with us 15% more often and bought 24% more fresh fruits and vegetables. Now, if you're a dietitian, you know that's a profound statistical change. That's not just a rounding error. And so Daily Table works with both recovery. So we've recovered well over 16 million pounds of food since we started. We work with manufacturers and suppliers of short code product, both national and local. Our emphasis is on local. But we get everything from working at the docks with fish that will get either donated or very cheap, and we can probably have the lowest price in America on fresh swordfish and tuna, et cetera. We work with Little Leaf Farms here, which is the largest hydroponic lettuce grower in America. They're about 30 miles from here, and they allow us to sell these beautiful tubs of lettuce for $1.99 every day. It's $3.99 at Whole Foods and Stop and Shop, and it's 99 cents if you're on SNAP. So what we've discovered is that by removing the barrier and creating an exchange where they come in to buy a product, it puts the power of the purse on them, so they feel a sense of agency. And there are a number of people, I could tell stories if I had time, and I don't, on the impact this has had. And I'll just share one, which was a mother who came in and burst into tears, and someone in the store came over and said, "What can we do to help?" She says, no, I just was down at Common Square Health Center, where we partner in Dorchester, and my son's pre-diabetic, and they told me what he had to eat, and I said, I can't afford that, and they said, go down to Daily Table. And I came in, and I can afford this. And there were tears in her eyes. Another gentleman came in and said, God bless you, I just came back from Common Square, I'm off my diabetic medicine, I've been eating your meals, because we have a kitchen that produces everything from entrees and soups and salads and smoothies and things, all according to the specs of the Harvard School of Public Health, Boston Medical Center, Children's Hospital. We got dietitians together so that they can have grab-and-go meals, and this was really critical. We also, most importantly, create jobs. We hire from the community. We pay living wage. So in Cambridge, that's $18.29 or 30 cents or something. And in Boston, that's 17, whatever it is, which is a burden on us as a nonprofit. But it's so important because we're hiring from the community. Our customers and our staff are one and the same. And so we try to have a mission that achieves its goals by the delivery of our service instead of just the funding. So we generate about 70% of our own revenue to cover our expenses, and we obviously count on property use for the rest. But in this space, both that blend of food recovery, special relationships with manufacturers, and going out and getting short code product to sell is critical. And I think that what I've seen is that, and I'll close with this, is that we're all relieved the pandemic seems to have been receding. It's gone maybe beyond just an epidemic, and now we're just concerned about COVID. But the effects of it, like a big ocean liner out of the ocean, you see go by, and then minutes later the waves hit the ocean, hit the shore. And right now, the impact and the effect of that is profound and needs all of our attention.
Doug, thank you so much for your work in this area. It's clear you have a keen understanding of the policy issues, and your strategic mind has really made a profound impact. So we thank you for being a partner in this work. Our next speaker needs no introduction. We are all very much looking forward to hearing what she has to share with us today. Catherine Clark, our Congresswoman and Democratic Whip from the 5th Middlesex District. Although she represents the 5th, she really represents all of Massachusetts and all of the country in her work. She is one of the smartest leaders I know. She has a keen awareness of policy issues, and she's an incredible fighter. When Catherine is on the job, we know that there will be an impact, and we know that we will make progress. So whenever I get to introduce her, I say that she is the person that gives me the most hope, because we know she's fighting for us in Washington. So Catherine, Congresswoman?
Well, thank you, Michelle. Thank you so much. I am so grateful to be here, and I'm so grateful to Harvard Law, to our students, to Emily, and to FoodLink for bringing us together today to talk about this topic. And Doug, thank you for your expertise, for your work, for your compassion. And Joe, thank you for sharing your story. Please check out Joe's Instagram. His artwork is incredible. And I just love that you are telling us your very personal story and how you wound up at FoodLink, but also you brought your community with us. And that's what this is about, because hunger is a policy choice we have made in this country. So let's be very clear about it. It is a failure. We can do this. We can feed every single person in this country. We have chosen not to. So that is where one of the many reasons, after giving what I thought was an extremely cogent argument on why I would never run for Congress, I announced for Congress about 6 weeks later, because we have to do better. And we have to make our system work for people. And we have to remember that when we are feeding Joe and the incredible people he brought with him today through those pictures, that we are all doing better. And that we are so tied to the 34 to 50 million people who are hungry in this country, and the 9 million children. And there were a couple of stories along my political life that really stood out. One was a mom that I met who who said she had to put her daughter to bed as early as possible so that she wouldn't feel her hunger. And that, as a mom of 3, just really stuck with me. Just making those choices, doing the very best she could to put food on the table, but it just wasn't enough, everything she was doing. Then there was a dad in the pandemic who I read about. I didn't meet him, but he was standing in line, and as Doug was describing that sort of wake effect of the pandemic, we're very much still in it. But this was in the height of the pandemic, and so many people who had never needed food before, never been to a food pantry, never been to Food Link, all of a sudden found themselves needing it. And this dad waited in line, but by the time he got to the front of the line, there was no more food. And he said, that's my failure. I have to get here for my family earlier. It is our failure as a system, as a political system, as a government, not that dad's failure. And the other story that really stuck with me was when I first came into Congress, I was meeting with a very large business group, and then we had a breakout session afterwards with leaders from higher ed. And you know, that is one of our greatest exports to the globe is Harvard. And in my district alone, I represent Harvard and Tufts and Brandeis and Bentley and Wellesley and Framingham State and Regis and community colleges, just this incredible wealth of higher ed institutions. And I thought, wow, they want to meet with me, and this is going to be about student loans, Pell Grants, you know, there were some taxes we were looking at on endowments. I thought that was probably gonna be a tricky issue. And the only thing they wanted to talk to me about was hunger with their students. And this was at our most elite universities. It was at UMass Boston. Homelessness and hunger. Those were the issues they said are the most pressing ones on our campus at this time, which was just mind-blowing to me. It maybe shouldn't have been, but it was really a revelation of where we are. So here we are in Massachusetts, 500,000 people go hungry, are food insecure, 120,000 kids. And we are so lucky to have Michelle Socolo and her creativity, her innovation, working with this incredible group of leaders to be able to pull us together. And I want you to know that these are plant-based plastic cups. I was like, Michelle allowed plastic cups? And I'm like, okay, they're compostable. But just thank you, Michelle, for your leadership, and you're just helping us be such a strong partner in the state level. So we have the nicest signs up here saying, please end, it's time for the next speaker. I've never seen such polite signs. 5 minutes, they say. But usually it's just a stop sign. But we're up against it in Washington right now. We have my Republican colleagues who have decided that as ransom for taking our economy potentially off the cliff with the debt ceiling, they would like to put in some very real spending cuts, we should say, to a lot of programs that will impact Americans in every facet of their life, but will be truly devastating if they should be able to be successful to SNAP benefits. Under their plan, 10 million people would lose SNAP benefits. That's 4 million children. Nutrition services like Meals on Wheels would cut 1 million seniors across the country. And it would end WIC benefits for women, kids, and babies for 1.2 million people. So that's what we're up against. And the good news is, we do have the Farm Bill this year, and it is one of these bills people always ask me, what's going to move? Is anything going to happen in Congress? The Farm Bill is going to happen, and I'm so grateful to the students for your work on pesticides, on minority farmers, and on SNAP benefits, because all of this food justice is really rooted in the Farm Bill. We have an incredible opportunity to do well. And the stakes are going to be really high, because how we manage to put this bill together and get it through the House is really going to determine a great deal of our future in the near term and the short term. And thanks to my incredible partner, Jim McGovern, who I'm sure you all know, who's just a leader in the country on these issues. We have had the first national strategy from the White House Conference on Hunger, Nutrition, and Health. And I know that many of you were there for this, but the Farm Bill really represents an opportunity to bring those strategies to life. Eliminate the time limit for able-bodied adults without dependents that we currently have. Increase the nutrition incentives, like Doug was referencing, also through the very successful Healthy Incentives Program. Improve college student eligibility. End the SNAP ban on formerly incarcerated individuals. And provide territories with the option of moving from block grants into the SNAP program, which would be tremendously helpful to Puerto Rico and to other territories that we work with. So I am just so grateful to have all of you in this fight. I look forward to your questions. I've already learned so much from our panel, and bringing that all back as we go into getting this Farm Bill done, getting our spending plan done, and truly working to make an economy where everybody can see opportunity and to make a better choice to feed Americans, every single one of them. Thank you.
Congresswoman, we are so lucky to have you fighting for us in Washington. We are stronger and better in Massachusetts because of all of your hard work, and we really couldn't move our Commonwealth forward without your efforts. So again, another round of applause. The next part of our program is a question and answer part, and many of you submitted questions before you came here today, so I have some lead-off questions, and then I think we're going to have an opportunity to pass the microphone if you still have a question that you would like answered. So I'm going to start by asking each one of our panelists one question, and then we're going to take the mic around to all of you. So get your questions ready if you haven't already submitted one. So the first question is for Joe. Sometimes it feels overwhelming to consider the complexity and deep inequalities of our food system. What are the ways community members, especially students, can most effectively help spur positive change within food systems and remain hopeful about the future of food justice?
Well, I think that, as I said before, most people in need did not plan it that way. It became time and unforeseen occurrences that befall us all. The reality is FoodLink has helped me tremendously, and thus I try to help others. I think that's a big issue of trying to help others. And sometimes we don't realize how much excess we have. And so it's not bad. If you have extra, how about just going next door? Hey, I got some extra food. Now I know I showed you Brandon and his grandmother. His grandmother likes ice cream. So anytime I get ice cream extra, I give it to her. She loves it. And Joe, my neighbor, the blind man, anything extra, I give it to him. So I think part of those who have tried to share.
Absolutely. Sharing is the name of the game. If we shared all of our resources, we wouldn't have anyone hungry in this country. Doug, I'd like to ask you, what more can we do? You spoke about this a little bit in your comments, but what more can we do to ensure widespread access, not just to calories, but to nutrition? I was really intrigued by your work on sort of the food as medicine concept. And Emily's worked on this quite a bit too, but could you say a little more on that, please?
Yeah, well, thank you. I think it's pretty much obvious to everyone in this room that the cheapest form of healthcare is good nutrition. And I think that what we can do is we can look toward, as far as it goes, one, we can look to support those representatives and that form of government that is caring for us as citizens. And I think that, Emily and I were talking about this earlier, I think it's always, I've gotten into this, it's amazing that we as a society have decided that clean air and clean water really matter, and that's part of the government. We should all take that on as rights. But somewhere we stopped at that access to good food, and that everyone should be able to afford nutritious food. So a couple of things on that. One is that, obviously, I'm not going to get into the whole issue of wasted food and all the things that were said about that were so important. But on the other side of it, I think that education is critical. So we have a teaching kitchen at Daily Table that we were up and going 3 days a week, and pandemic hit, of course, and then we're now just starting back up again. But it takes kids, 4th grade and up, all the way through seniors, and then gives them free of charge ways in which they can prepare foods that are tasty, convenient, affordable, and quick. So I think one is education. The other, I'd say, most importantly to me, quite honestly, is that in the 13 years I've been involved with this, since leaving Trader Joe's and doing this fellowship, that I've run across so many institutions, so many organizations, FoodLink, so many others that do amazing work. What sometimes is missing is the will or the bandwidth to look at how can we weave that together. There's so many threads of great activity that, woven together, I think would make a much stronger net, so to say, safety net. And so one of the things that Daily Table's worked with from the very beginning, working with Catherine D'Amato and working with Boston Area Gleaners, Food for Free, FoodLink. Occasionally when we get excess product, as Rachel knows, we'll give this to FoodLink. And because our motto is that, and certainly in our stores, when we produce product that have short code date, unlike the average grocer, we don't pull that off, even though we do composting and recycling. Our motto is food only goes out the front door. So at 6 o'clock, if there's product we produce in our kitchen that has that day's code on it, it becomes free. And we'll have a number of everything from unhoused to individuals coming in knowing at 6 o'clock I can get food for free in these stores. Because we much prefer that than taking it off the shelf and putting it in the back and sending it off to compost and whatever else it is. So I think that just having us all work together in ways in which we can look at aligning and covering gaps would be the biggest thing, because there are amazing organizations out there. Final thought on this, I'm sorry because it's just exploding with thoughts on this, is that we forget that this is a part of the structure that, like every other part, innovate or die. We've got to look at innovative ways to do it. If we keep doing just what we've been doing, we're going to end up with the same result. So food banks do phenomenal work, and they're necessary. But I hope that every one of them would also acknowledge they're not sufficient, for the very reason that 38 to 40% of the population won't use them. Second is, not one of them can provide all the calories you need. They subsidize those meals, so what are you going to do in between that? So working with grocers to have healthier and on their end caps, et cetera, working with other organizations to innovate ways in which we can have access to affordable nutrition.
Emily, could you talk to us a little bit more about college food insecurity? How big is the problem? Help us define it, and what can we do about it?
It's a great question. I want to just say on that, I had a huge second to everything Representative Clark said. So I had a list of like our top priorities that we've talked about in SNAP. I think you hit every one. So glad we have you, at the forefront of this. I think it's so important, and I think circling back also to what Doug said, we talk a lot about the pandemic recovery being K-shaped, and what that means is that for a lot of people, they've bounced back, think they've moved on, life has gotten more or less back to normal, maybe with more work from home days or whatever your, pandemic changes were. But for a lot of people, especially with the end of, a lot of the emergency SNAP benefits and the end of the public health emergency, the extra supports are going away. So one big thing that we saw was between in 2020 and 2021, actually nationally the rate of food insecurity did not increase. And lots of people say, well, how could it not have increased? It didn't increase because we realized that when we give people the money that they need, the resources that they need to obtain food, when we have programs like the Farmers to Families Food Box that are obtaining food and getting it to people, that the rate of food insecurity levels out or goes down. And I think that, my fear is really that right now we're going to see all of these things have just ended. We're going to see a lot of increasing, health issues, food insecurity, poverty, all of those worst things. Now is the time that we'll start seeing that. So I think I'm going to respond on college food insecurity. I want to just also build on some of the food as medicine piece that Doug talked about. It's a huge problem. I think even, Doug mentioned in the richest country in the world, how can we have so much food insecurity? I mean, in the richest university in the world, how can we have so much food insecurity? It's really a pervasive problem, and I think it's really often invisible. I think one of the biggest things is really thinking about, one of the challenges for college students is having to have work requirements on top of the hours that they already are in school. So a big piece that we've advocated for would be getting rid of the need for any students studying full-time in a university that, or part-time, that the hours that they're in school should count as the hours that they're working, because they're trying to build the knowledge and skills to have a career down the line and get off of this treadmill of needing to be on support. So that's a huge thing. And then I just want to say a few words about the opportunities in food as medicine, because I think we've covered, some of the other areas. I think on SNAP we have a number of fierce advocates out there working on that. And I think there's also these opportunities to really think about making sure we're getting people healthy food. So I'm going to say, I guess, 3 really quick ones that we've worked on. One big one is that there are lots of pilots and experiments on this theme of innovation, of really providing food as a covered benefit. So if a doctor says, my patient really just needs healthy food, they don't need medication. But most of those are going on at the small scale level, funded by philanthropy. There are a growing number of states that are implementing waivers in their Medicaid program to try these out. Massachusetts is at the forefront of that. But we've really been pushing for a large scale pilot through the Medicare program. That is something that could be done by Congress and was actually endorsed in the strategy that came out of the White House conference. The other big one is really needing for more research into this area as far as what we need to do. And there's been efforts at the National Institutes of Health based on a lot of pushing from many different advocates to really be pushing to create a food as medicine center of excellence. And there's been efforts. I think the big question there is really funding from Congress to get that off the ground. And then the third that we've done a lot of work on is actually trying to get doctors more educated in food. So I was mentioning to Doug before this, we've done a lot of work on this. I can give you a bunch of shocking statistics, but one that really stuck with me was that before entering medical school, more than 75% of entering medical students believe that food is important to health. And upon graduation from medical school, less than half believe that food is important to health. So they are unlearning a basic fact on their journey through medical school. And so we've been really involved in this, and actually I think there's been some movement. There was a resolution that the House of Representatives passed last year really calling on medical education to change this. A couple weeks ago I was in Chicago at a conference of the main accrediting bodies in medical education really talking about doing this. But I think there's more opportunity, particularly because medical schools and especially residency programs receive the lion's share of their funding through the Medicare program. So they're getting all this money from Medicare to then not be able to serve the very patients that that are suffering from so many of these diet-related and chronic diseases. I could go on, but I'll cede back to our moderator.
Thank you, Emily. Congresswoman Clark, you spoke quite a bit about the SNAP program and other federal assistance programs, and I'm sitting here thinking a little bit about how can we better partner with the federal government at the state level. What policies and programs do you need us to advance to support you? On the positive side, just last week we passed a supplemental budget here in Massachusetts that recapitalized the SNAP program and also the school lunch program. We also have been very supportive through the budget of the Health Incentives Program, which allows SNAP users to buy and use their benefits at farmers markets. But with a divided Congress, but a Democratic administration, I also am thinking a little bit about the opportunity for policy making through regulation and wondering how we can all support you potentially in regulatory rulings that could move the policy needle forward. So can you speak to that a little bit about how we partner with you and how can we help support your efforts?
Sure, and everybody wants to jump in on the last question, so I just want to do one quick shout out to MGH Revere, which I was just at the opening of their new kitchen for patients where doctors prescribe the food pantry, and it is accessible, and they are then just built a new test kitchen where doctor chefs are coming in and teaching people how to cook with the vegetables, and it is very culturally appropriate, and just what you were saying, and we need to follow up in making sure that that is reimbursable and that that is treated as any other prescription would be treated. So I think we have a real advantage in the Biden administration. The budget that Joe Biden just put out calls for an end of hunger in this country by 2030 and is very concrete about how we get there. And part of it is $8 billion in private sector funding to do exactly what Doug was talking about, helping us pull the threads of the great work that's out there together. And so that we are utilizing, much like we see, I always brag that this district in Massachusetts is such a hub of science and innovation and technology because we have great academic labs that we then are the best in the world in turning into the marketplace and actually moving forward in turning this into treatments for patients. We can do the same here and really be that example. And Michelle just mentioned, but Massachusetts is one of the first states, I don't know if there's any other that has expanded and continued the school lunch program and the free breakfast programs that came during the pandemic, but are now coming to an end. And so, this is really a partnership, and we have to look for those regulatory changes that we can make that don't have to get through what is a divided Congress at this point. And I think that not only is it our moral imperative to follow this blueprint that the Biden administration has put out, but I recently had a meeting with the Pentagon, and they're very concerned about national security. And what Doug was also mentioning, that the obesity crisis, which means that currently if you lined up all the eligible age people to serve in the military, only 1 out of 7 would be able to actually serve, primarily due to obesity. And so all these generals who are now coming together have identified food and nutrition as a top national security issue. And I think we have to use this to frame this issue maybe a different way, and maybe for some folks it gets out of this idea that there is a shame that they carry when looking for help, that there is a shaming that goes on, and we're about to see a whole lot of work requirements proposed, which, we can have a much longer conversation about that, but, I think that looking at this from trying to close this political divide by, if you don't want to talk about moral failures and making bad choices and that hunger is a choice for our kids, let's talk about military readiness and how if we don't have good nutrition, we're not going to get there. And don't take it from me, take it from the Pentagon. And they are about to put out a really scathing report on what this means, and something we should all be paying attention. So we have to do everything we can on the regulatory side that doesn't have to come through Congress, but we also have to think about ways that we can engage people in a different lens that they can view this through.
Wow, Congresswoman, that's Mind blowing.
And pass the child tax credit. We could start there. We halved poverty in less than a year, childhood poverty in this country with the tax credit. We know it works.
Fantastic. Okay, so I think we can take a couple of questions from the audience, and then we have to wrap up. So someone has a microphone out there that they were going to carry around in the back. Okay, so if you have a question, please raise your hand, and our helper will bring the microphone to you. Let everyone go at once.
Hi, thank you all. I'm going to stand up. I'm Marsha Robinson. I represent an organization called Three Squares New England, where we're raising funds for organizations that are fighting food insecurity. But one of the questions that sort of triggered in my mind, I was listening to the amazing speakers, is are there ways to create incentives at the insurance industry level, similar to you can't throw away food? Can we sort of work with the large insurance industries? We're blessed in Massachusetts, we've got some really good ones. To think about, are there incentives to give back or reduce the cost of insurance for families who are sort of purchasing healthier nutritional foods? So I don't know if that's on the table, but I'm throwing it out there right now.
That's a great question. Do any of our panelists want to take that one?
I'm happy to start. I think it's a really great point, and I think, you know, again, really thinking about this food as medicine concept that, you know, really tying together. One of the biggest challenges, truly, and is that we have such a fragmented insurance system. So it's amazing with the Affordable Care Act that we've expanded insurance coverage for so many. I think, you know, the bigger challenge for a lot of families is really not being able to kind of afford. So in our work, we focus a lot on how can we have insurance cover the food, but there are certainly some insurers that are also starting to experiment, and I think more at the private insurance level in terms of like worksite wellness types of things, and saying, you know, if you, there's also some incentive for people who have a gym membership, and so they go to the gym, but to eat healthy. And so I think there's a lot of experimentation going on. I'm hopeful that when we find the things that work, that will be able to take root. But it's also an issue that there's so many that still aren't on insurance programs, and I think that's sort of our next big challenge is, you know, how do we get to have coverage for everyone?
If I could just mention also that one of the challenges is that it's really tough to show impact. It's really tough to show impact when you have a program that's just a part of someone's diet. So we're part of a 3-year program with Blue Cross Blue Shield and it's called .RX with Dorchester's Common Square Health Center, where they have a coach, they help subsidize purchasing at daily table, et cetera, because again, we don't sell anything that's not going to help move your health forward. But frankly, I think the results of that are going to be limited only because it's a very limited, it's like a supplementation. Meanwhile, they're in an ocean of poor food and activities. So I think that it's really about, can the insurance companies either start to get the funding devoted to it that will meet meaningful change? Because I don't think anyone argues, and certainly the Harvard School of Public Health wouldn't argue that good eating has good outcomes. But it's tough when you simply provide a small incentive, and that incentive then becomes lost in an ocean of other cheaper, calorically dense but nutritionally poor food. So I think that it's really around, it gets back to what Congresswoman Clark was saying around, it's about the will and about do we care. And as a nation, we certainly have chosen, unfortunately, not to. I think, by the way, I think that community servings is one that really takes advantage of that medical insurance system.
Thank you so much for everything that you've talked about today. I'm at Bunker Hill Community College, and at the college in 2011-12, we started with the Greater Boston Food Bank, bringing food to the students, and people's mouths just opened. This became an issue. Food insecurity on college campuses wasn't something that people could wrap their heads around. You're in college, how can you be hungry? Not only do we have students who are hungry, we have students who are homeless. And the idea that you brought up before about SNAP being so wonderful, but the stigma has prevented people from getting help. So my ask for everybody here is to make the conversation a conversation you have at your dinner table, when you go to a party, when you're talking to your friends, because if we don't change that conversation, things will not change. As soon as you start talking to somebody, everybody says, yeah, we can share food. Yeah, we can talk to people, but it really has to be done. The stigma is preventable. It's really changing the conversation, talking about it, having people come to this. At the college, we have forums where people come. We have professors who will do things in their classrooms. We have a food pantry where we talk about it. When I go to classrooms to speak about food insecurity, you see the people start squirming who they didn't want anyone to know. I just say, you know, if anyone needs any help, come to me. I open up my email this morning. You spoke at our class yesterday. Can I come to your office? It has to change that way. Right now in Massachusetts, we have a bill that's hopefully going to pass this year called the Hunger-Free College Campus Bill, where we're hoping if you all want to do something, call your legislators and ask them to pass that, because that is critical. So I hope that everyone will do that. Thank you for all your innovative ideas, but if we all get together and push for this. And FoodLink was one of our top for those who are here for FoodLink. We so thank you, because that's what started the conversation on our school when in 2011, Julie and Deanne started picking up food, dropping it in my car at night. We bring it to Bunker Hill, and that followed with their volunteers. And students would come, professors would come, and that's where the food issue really started growing at that point. Thank you very much.
I think this has to be our last question, then we have to wrap up, because we're supposed to be done at 10:30. It looks like we're going to go over a couple minutes as we conclude.
Hi, my name is Hal Schubin. I run the Farmers Market in Belmont. We've got one of the best food assistance programs around. This summer we'll have 4 HIP vendors. And HIP is a great program. It gives basically free produce to people that receive SNAP. And I love explaining it to people because their faces just light up. But it requires so much explanation because the implementation is really difficult. We talk to people once in a while and they say, well, yeah, we're working on it, but nothing's changed. I've written up a long list of problems and some solutions and sent it to everybody I could think of, and this seemed like a good situation to bring it up. We'll talk, yeah. So I'm hoping that it can be changed so that more people know about it and can take advantage of it, because it's really just a wonderful program.
Thank you. Okay, one more question? I'm seeing we can have time for one more question.
Good morning, everyone. Hi, my name is Stephanie Campbell, and I work with Health Leads, which is a nonprofit innovation hub, and we have some work focused on food in Boston. So thank you. This was so great and so helpful. I have a question, mostly for you, Doug. I'm curious in terms of like how you all select different cities and towns for daily table openings, because there's so much need in the Commonwealth, and we know these are layered issues, right? So we're thinking from the top of communities, as you said, like high in calories, or typically our communities have suffered from long-term disinvestment, structural racism, like so all this multi-layered. So I'm curious on, not just to put it on Doug, but like your expansion plan across the Commonwealth, but the real focus on BIPOC communities, and other folks, please feel free to weigh in.
Well, it's a great question. The sad thing is there's no shortage of sites that need support, whether it be Daily Table or other organizations. We, frankly, being a under-resourced, capacity strained nonprofit, we go where the opportunity is. So the first was when Codman Square Health Center said, we have this space, we'll give you below market rent, come on in because you're aligning with our health initiatives. We've been there now almost 9 years, and it's been great. Then we went with Madison Park, the largest CDC and oldest in Massachusetts. Third store in Cambridge Square just came about. We just opened last Thursday in Mattapan at where the end of the red line is, there where the organization POA, which is the Preservation of Affordable Housing, built 100% subsidized housing units, and then asked us to come in on the ground floor, gave us, again, below market rent. And then finally, we're opening in August in Salem, this woman you might have heard of, Kim Driscoll, who was the mayor of Salem. I would affectionately say pestered me with phone calls direct on my line. You know, he's like, "Hi, who's this? I am Kim Driscoll, I'm mayor of Salem. What can I do for you? We need a daily table." And it's like, well, you're in Salem. There's so many other spots between here and there. But we went up, we saw it, and sure enough, she helped us get a spot with the Archdiocese of Boston, had a site they turned into a building there, and we'll be opening at the point. So these are what happens is it's opportunistic. We're looking at a site in Framingham right now, that again is an opportunistic site for us. It's really around the fact that here's the way we look at it, and I think this is true for everyone, which is nonprofits are under-resourced. And so for us, it's around, if we particularly have a model where we try to get as much revenue generated as we can, but we have to make sure that we aren't taking it out of the pockets of people that need it any more than we need to. So we need really low rent. And so it's really about partnering with organizations that can provide us a site in the community that the community would want to go to that's at rent that's affordable. And I think that's true, taking it out of daily table, I think that's true when you look at resources, whether it be warehousing, trucking, et cetera. What's missing in this whole thing is often the last mile. Is there's lots of food available, but it costs transportation quite a bit to get there. So that the whole food, the enhanced deduction, doesn't cover transportation. And so if we could have a way that truckers could get an enhanced deduction for handling food going to a nonprofit, I think there'd be a lot more of it available.
I'm going to pick up on that because it's like an invitation very quickly on the policy side. So I think what we're seeing, so I mentioned Massachusetts has this law restricting food being thrown away. We're now one of 9 states. And the more we talk and the more we really think about food as a resource, it's putting an amazing burden on these organizations like Daily Table and FoodLink that are trying to keep up with the kind of demand on the side of businesses that have surplus, but also on the side of those in need. And I think there's a couple really big opportunities on the policy side. One is really to invest in the infrastructure, and the infrastructure including transportation, vehicles, locations, especially with like a public facing things like this where you need to be in a location where there's foot traffic. And as you just heard from Doug, I mean, those places usually don't have the low rent. But I would say also, and I will speak for Doug in this case, I know he and I have also spoken with people in other states that are interested in this model. And I think there's a lot that can be changed on the policy side to make it easier to have models like this that are nonprofits that are bringing in food and selling it at a low price that helps cover their costs. There's been some change in federal law to make it easier in terms of expanding the liability protection for donors that donate to organizations like this, which is something we've worked on for a while. But the tax piece that Doug mentioned is also still a barrier. Right now, businesses can only get a tax benefit when they donate food to a nonprofit that gives it away for free. And I think there's an opportunity there, both looking at the state level, states like Massachusetts that are considering creating a tax benefit. We're one of the states that right now doesn't have a special tax credit for donation of food, but also looking at the federal law that's out there and really expanding that. These are charitable organizations, but it's expensive to get food and get it to people that need it and do it in ways that promote dignity and that are making sure that food is delicious and presented to people in ways they want. So lots of opportunities here, I think state and federal, to make this easier.
So much to think about. So as we begin to wrap up our panel, thank you all for hanging in there with us. We're running a couple minutes over, but we just have one more lightning round, and then we're going to bring up our closer. So each of the panelists, we just want to know, in 30 seconds or less, what is one thing that you want the audience to leave here today and go do? We want to make sure we close with the call for action, and whoever wants to jump in when they're ready, what should we each leave here today and go do? Joe, go ahead.
Don't hide, divide.
Vote for food. Make sure you ask every candidate at every level of government where they stand, what they're going to do, and then vote accordingly.
Can I second that one? There's so many, everyone has a role to play in this. No matter what you do, you're both, yourself eating or feeding your family, but also in your own workplaces, educating others about this. We talked about the Farm Bill. There's opportunities this year in particular to really be talking about why this matters to you and making it clear to your elected officials at all levels that you want to know what they're doing.
Well, besides volunteering at FoodLink or Daily Table, what I would say is hold people accountable to what you care about. And not just in voting, but in how they act. If you see food being thrown out, you can ask, wait a minute, couldn't that have a better, can't that be repurposed? Et cetera. I think just putting care into action is what I would ask.
Such great answers, and I would add to it, we need to share more. We need to invite people to our own tables, divide what we have, and share at lunch, wherever you can. I think that's something else we can do. So I want to thank our panelists. They've been wonderful, and all of our audience has been wonderful. And give us some final words with Sophie Devoe.
Thank you again so much to our panelists, to Representative Sokolow for moderating. I just want to end with my call to action on behalf of a small local nonprofit that is working within a really very richly cultivated community. I think as folks mentioned, even though we're working very collaboratively together, there's nonetheless still quite a bit of fragmentation. And I would urge you to find a nonprofit or a government representative or a private industry. Again, coming back to the thesis of our panel, all of these sectors are doing really good work. And I want to echo what Joe said, which is really keep it local. Look out for your friends and neighbors, because it's a tough world out there. Thank you.
I also want to say a big thank you to our panelists and to our audience. And thank you for your wonderful questions. And our call to action is volunteer and donate wherever you can, however you can, hopefully locally with wonderful organizations like FoodLink and Daily Table. Call your representative, reach out to them, encourage them to take action and support policies to reduce food waste and reduce food insecurity. And then finally, reduce food waste yourself at home, however you can. Make sure you don't buy too many groceries, that you are being aware of what you have in your fridge, and that if anything does need to go to waste, that you're composting it. So again, thank you so much to everyone, and this was wonderful.
Thank you.